Psoriasis and its connection to chronic diseases, natural approaches for symptom management. Introduction. Psoriasis is a chronic autoimmune condition that affects approximately 7.5 million Americans, causing physical discomfort, emotional distress, and increased healthcare costs. In 2013 alone, the direct and indirect costs of managing psoriasis amounted to nearly $112 billion. Beyond the visible skin manifestations, psoriasis is closely linked to several chronic health conditions, including type 2 diabetes, asthma, and cardiovascular disease. While conventional treatments aim to control symptoms, they often come with significant side effects and fail to address the underlying causes. Recent research highlights the potential benefits of natural interventions, including sun exposure, vitamin D, omega-3 fatty acids, and common kitchen ingredients, offering a promising alternative for reducing symptoms and improving overall well-being. Understanding psoriasis, an autoimmune condition with far-reaching effects. Psoriasis is an immune-mediated disorder characterized by the rapid overproduction of skin cells. This accelerated cell turnover leads to the formation of thick, scaly patches on the skin, often accompanied by itching, redness, and inflammation. Psoriasis is not merely a skin condition. Its systemic nature places affected individuals at higher risk for developing metabolic and cardiovascular diseases. Types of psoriasis. There are 5 main types of psoriasis, each presenting with unique characteristics. Plaque psoriasis, the most common type, characterized by raised inflamed lesions covered with silvery white scales, typically appearing on the scalp, elbows, knees, and lower back. Guttate psoriasis. Often triggered by bacterial infections, this type presents as small red spots scattered across the body, commonly affecting children and young adults. Inverse psoriasis. Found in skin folds such as the armpits, groin, and under the breasts, inverse psoriasis causes smooth, shiny, inflamed patches that worsen with friction and sweating. Pustular psoriasis. Marked by white pustules surrounded by red, inflamed skin, this rare form can be localized to specific areas or widespread, requiring urgent medical attention. Erythrodermic psoriasis, a severe and potentially life-threatening form that causes widespread redness, severe itching, and peeling of the skin. The link between psoriasis and chronic diseases. Mounting evidence suggests that psoriasis is more than a skin condition. Its inflammatory roots make it a systemic disease that impacts multiple organ systems. Type 2 diabetes, chronic inflammation associated with psoriasis, increases insulin resistance, elevating the risk of developing type 2 diabetes. A meta-analysis published in JAMA Dermatology found that individuals with severe psoriasis are 30% more likely to develop diabetes compared to those without the condition. Cardiovascular disease, psoriasis is associated with an increased risk of heart attack, stroke, and other cardiovascular complications. A study published in the American Journal of Cardiology demonstrated that patients with severe psoriasis had a 53% higher risk of major cardiovascular events. Asthma and respiratory disorders. Psoriasis-related inflammation may contribute to airway hyperresponsiveness and increase the risk of asthma. Studies have shown that individuals with psoriasis have a 20% higher likelihood of developing asthma. Conventional treatments, limitations, and risks. Physicians commonly prescribe corticosteroids, immunosuppressants, and biologics to manage psoriasis symptoms. While these treatments can provide temporary relief, they often come with adverse effects that may compromise long-term health. Potential side effects include immunosuppression, increased vulnerability to infections due to dampened immune responses, liver and kidney damage. Long-term use of immunosuppressants and biologics may strain the liver and kidneys, leading to organ damage. Increased cancer risk. Some biologics have been associated with a higher risk of lymphoma and other malignancies. Skin thinning and rebound effects. Prolonged use of topical corticosteroids can thin the skin and lead to severe flare-ups upon discontinuation. Given these limitations, many individuals seek safer, more sustainable alternatives to manage their condition. Natural approaches to managing psoriasis. Promising research suggests that natural interventions may help reduce psoriasis symptoms by addressing inflammation, supporting immune function, and improving skin health. First, sunlight and vitamin D, nature's anti-inflammatory agents. Sunlight exposure is a well-established therapy for psoriasis, as ultraviolet UV rays slow down the rapid proliferation of skin cells and reduce inflammation. Moderate sun exposure stimulates the production of vitamin D, which plays a critical role in immune modulation and skin health. Scientific evidence. A study published in the British Journal of Dermatology found that psoriasis patients with higher vitamin D levels had fewer flare-ups and improved symptom management. Vitamin D analogs such as calcipotriol have been shown to reduce the severity of plaque psoriasis by modulating immune responses and slowing down skin cell turnover. Second, omega-3 fatty acids, reducing inflammation from within. Animal-based omega-3 fatty acids found in fatty fish like salmon, mackerel, and sardines possess powerful anti-inflammatory properties that may benefit psoriasis patients. These essential fats modulate the production of pro-inflammatory cytokines and reduce oxidative stress. Scientific evidence. A meta-analysis published in Clinical, Cosmetic, and Investigational Dermatology concluded that omega-3 supplementation significantly reduced psoriasis severity, particularly in patients with mild to moderate forms of the disease. Omega-3 fatty acids support the production of anti-inflammatory compounds known as resolvins and protectants, which help mitigate chronic inflammation. Third, aloe vera, a natural soothing agent. Aloe vera gel, derived from the leaves of the aloe plant, is renowned for its soothing and anti-inflammatory properties. It helps calm irritated skin, reduce redness, and promote healing. Scientific evidence. A double-blind, placebo-controlled trial published in the Journal of Dermatological Treatment demonstrated that aloe vera extract improved psoriasis symptoms in 83% of participants, compared to 7% in the placebo group. Fourth, apple cider vinegar, restoring skin pH balance. Apple cider vinegar has been used as a natural remedy to relieve itching and inflammation associated with psoriasis. Its acidic nature helps restore the skin's pH balance and prevent bacterial infections. Scientific evidence. Although scientific studies on apple cider vinegar for psoriasis are limited, anecdotal evidence and traditional use suggest that it may provide symptomatic relief when applied topically. Fifth, turmeric, modulating inflammation through curcumin. Turmeric, a spice widely used in traditional medicine, contains curcumin, a potent anti-inflammatory and antioxidant compound that may help manage psoriasis symptoms. Scientific evidence. A randomized controlled trial published in Biomed Research International showed that oral curcumin supplementation reduced psoriasis severity and improved quality of life in participants with mild to moderate psoriasis. Integrating natural therapies, a holistic approach. For optimal results, combining natural approaches with lifestyle modifications can help manage psoriasis more effectively. Key recommendations: maintain a balanced diet, focus on anti-inflammatory foods such as leafy greens, fatty fish, nuts, seeds, and antioxidant-rich fruits. Avoid processed foods and sugar, which can exacerbate inflammation. Manage stress. Chronic stress can trigger psoriasis flare-ups. Incorporating relaxation techniques like yoga, meditation, and deep breathing can support emotional well-being and reduce inflammation. Support gut health. An imbalance in gut microbiota may contribute to inflammation and immune dysregulation. Incorporating probiotic-rich foods and fiber can enhance gut health and immune function. Conclusion. Psoriasis is a complex autoimmune condition that extends beyond the skin, increasing the risk of chronic diseases such as type 2 diabetes, cardiovascular disease, and asthma. While conventional treatments may provide temporary relief, they often come with considerable side effects. Emerging research suggests that natural approaches, including sunlight exposure, vitamin D, omega-3 fatty acids, and other holistic interventions, may offer safer and more sustainable alternatives for managing symptoms and promoting overall health. By addressing the root causes of inflammation and immune dysfunction, individuals with psoriasis can take control of their condition and improve their quality of life.